Thanks, Jen. So the committee followed its statement of task. We collected and analyzed and looked at a range of data. What recommendations did we derive? Let me just, as an aside, reinforce the roadmap to this very large document for you. You just have time to get to the website and have limited ability to focus on reading the vast range of material in the report. Go to the summary. That really walks you through all of our recommendations in brief, the most cogent summary of each recommendation in a variety of areas that track to the chapters. You can download the chapters one by one if you want. And then go to Appendix B, because that's where the recommendations are laid out in a bit more detail. So there's the recommendation and a bit of text around implementation of that recommendation. Okay? And these slides, by the way, will be available on the IOM website following this brief. But let's just move now to kind of the highlights. And I'm going to really summarize here some of the cross-cutting themes of our recommendations that do go across different domains, such as prevention, care, and treatment. As Jen alluded to, and as we all, I think, feel quite strongly, there really is an urgent opportunity right now, given the constrained global economy and the growing need for prevention, treatment, and care, for PEPFAR to work with partner countries in a collaborative way and to help with priority setting and giving guidance and tools for each country to manage its own epidemic in a coordinated function to reflect each country's specific needs. We all know that the epidemic profile varies from country to country and even within country, and there's a targeting of resources and matching the resources to the need that really needs to take place. So just to pull out some highlights for that, for example, we know that those of us who work in this arena, particularly on the clinical front lines, we know that we're missing a lot of opportunities to get people tested so they know their serostatus, to link them in an efficient way to get to care, to get them on antiretroviral therapy and other clinical needs, and then to keep them in care for a lifetime. This is a huge challenge. It's not unique to PEPFAR, but it is the reality for HIV disease. We know that people drop off all along that cascade. This will be an ongoing issue for programs that are supported by PEPFAR or working with PEPFAR, as well as right here in the US. And so this is one of those arenas where we learn from PEPFAR-funded work that applies even here domestically. We know that we need to identify populations that have the highest needs. And those groups are going to need the best set of packages to address their primary and secondary prevention and care needs. We did talk in the report about the need to really focus on prevention. That's the only way to get ahead of this epidemic, to get to that tipping point that people are talking about now, where the number of people going on antiretroviral therapy will become more than the people who come into the system because they become HIV infected. So we really said that there really needs to be an emphasis on looking at the prevention portfolio on sexual transmission, that is the preponderance of transmission around the world, and that there need to be balanced approaches and packages, combination packages that include not just the biomedical advances, which have been quite a number in the last year or so. Since the time of our report, for example, the HPTN 052 study came out, so this idea of treatment as prevention is kind of a newer element to put into combination prevention packages, but that the biomedical alone won't address all of the drivers of the epidemic, and there need to be structured combination prevention packages. And again, targeting, efficiency, you'll hear these themes when we talk about prioritizing the response according to the need. One of the things that PEPFAR has done, it has certainly invested in a lot of monitoring and evaluation, and there, as we heard from the field and on the ground, there's a tremendous amount of energy put into collecting data that gets reported up the chain in various ways. And a lot of the initial response of PEPFAR, recall, it did start as an emergency response, so it was really all about, can we hit these dramatic targets of getting people on treatment, of getting prevention services out, and really focusing on numbers in terms of process numbers and activities. We really feel strongly that there's now a need and an opportunity to shift to focus on outcomes. That's really where we want to get. What are the outcomes in terms of reductions in morbidity, mortality, and infections averted? And working with, again, as PEPFAR shifts more to a role of working with countries to help them prioritize how to get to those outcomes. So again, another example, looking at ways to, best practices to improve retention in care, sharing those best practices, increasing coverage of HIV testing, particularly for infants and children, as well as youth and adults, being able to have some concrete outcomes in the area of OVCs, for example, staying in school. And again, with the gender arena, and there is a whole chapter on this, looking at some more concrete objectives so that we are able to show more firm outcomes. One of the other consistent themes in our recommendations is really the opportunity for PEPFAR to focus and invest in the ability of countries to have capacity to shift to a more sustainable and country-owned response in their own epidemics. And we see that there are some particular arenas in which this can be particularly targeted around service delivery, financial management. This is a consistently mentioned need on the ground. It's a particular kind of skill set that's absolutely foundational to running programs. You have to have the clinicians, but you also have to have financial administrators who can run things effectively. Program management, again, a similar kind of administrative skill set that's needed. And then knowledge management. And that was one of our really strong findings, is that there is a real opportunity for PEPFAR to understand its own practices, have partner implementers be able to identify and scale up and share their best practices, and contribute to the global knowledge base in terms of information that's collected and shared and archived and used. Turning to the sustainability question, obviously there has been a transition over time in the idea of PEPFAR being a direct service provider, and now needing to shift in the longer term to more of a technical assistance role as countries take on, over time, the ability to more sustainably manage their epidemics. Again, the committee felt that that shift to country ownership and sustainability is a reasonable goal. It also involves some risk, which we recognize, and there will need to be a longer time frame for some countries than others in that transition process. But again, PEPFAR has a good technical assistance role in helping countries to really know their epidemic, project their needs, be able to identify where the gaps are in treatment gaps, help countries think through some of the ways to reduce the fragility of their donor dependence, and project the cost and the program allocation needs. And then again, to share that information more transparently among all the stakeholders, including multilaterals and countries and civil sector. And finally, establish priorities and benchmarks for success in this arena. Program monitoring, evaluation, and research. Again, PEPFAR has, over time, moved in several ways to try to be a learning organization and collect and share data that will allow programs to be more effective. But we think, again, this really needs to be done in a more consistent way. And what we're recommending here is not collecting more data, because there is a huge burden on the ground with data capture, but better, more efficient use of data that can be reported up at a very aggregate level that harmonizes with global measures and that gives us some real indicators of impact, as well as program level data, so that people can, in more real time, have information about their own program delivery and that of their peers to improve the work they do. So this ties into the health system strengthening arena, and it really ties in as well to this issue of supporting sustainability. And again, being able to contribute to the global knowledge base in general. So to wrap up, we can quite conclusively say that PEPFAR has really been transformative with its role and contribution to the global pandemic. In many regards, it reset the baseline, it moved the goalposts. The game's not done, the work is unfinished, the unmet need is still there. PEPFAR support in the arenas of prevention, care, and treatment have had many positive and major impacts, both at the individual, community, and country level. We heard very consistently from people on the ground that it's viewed as a lifeline and that it's brought hope and new ways of looking at the opportunities. for people to work with their governments and civil sector as well in program ways, as well as in terms of people's families and lives being restored. We're moving into a new arena here. It's a new era. It's not emergency response anymore. It's transitioning now, and that's probably going to be an era where there's less focus on the direct service provision and how many numbers were served with X, Y, and Z program category, to an arena that really looks at, are we building systems and partner capacity together, collaboratively, planfully, to address epidemics like HIV over the long haul. But that's a huge opportunity, and we would see it as a kind of a quiet revolution in a way. And so we think that PEPFAR, again, has a very important role in its next evolution. I want to just close with the acknowledging the phenomenal staff who were just absolutely superb, leadership by Kimberly and Bridget, and all the staff that you see listed here, as well as our consultants, who were absolutely integral to getting this report done. Thank you.